Hello, future RMTs. Welcome back to our virtual classroom. And in today's lecture, what we're going to discuss is all about the microscopic examination of urine. And for this lecture, our learning objectives or learning outcomes are as follows. Number one, or 6.1 is to identify the different urine crystals, cast, and sediments. Number two is to discuss the clinical significance of abnormal cast, crystal, and sediments. As we all know, microscopic examination of urine is the last part of the urinalysis, no? We said that there are two major parts of our urine examination. One is the macroscopic examination, which includes the primary investigation, such as the physical examination of the urine, and the examination of the chemical constituents of the urine, which is the chemical screening or chemical examination. And the last part and the most crucial part of the urine examination is the microscopic examination of urine. From the word itself, microscopic examination, it means we are using the aid of the microscope in order for us to visualize, to detect, and identify the insoluble materials in the urine. Because these soluble materials contains our uh, chemical can be assessed, no, in our chemical analysis. Okay. So what are the contributors of these elements that can be found in the urine? So we have there the blood, the kidney, the lower genitourinary tract, as well as the external contaminations. Okay, so these four are the contributors or the factors of the elements that can be found on the urine. And if you're going to discuss these elements that can be found in the urine or these insoluble substances, what are those? We have the RBC, the WBC, the bacteria, yeast, parasites, mucus, spermatozoa, cast, and crystals, okay? Which will be discussed in further as we go along in this discussion, okay? So we have here the correlations of the macroscopic and microscopic examination. As our objective or outcomes for this lecture is for you to identify and for you to correlate, no? The microscopic examination of the urine is like this. The chemical examination of urine is like this. The physical examination of urine is like this. So we are going to correlate if the results of our analysis agree to each other. If they are coming up or if they are uh, correlated, no, with one another, is the result acceptable? Okay? The reason why it is important for us to really perform our tasks, our duties in performing the macroscopic, which includes the physical and chemical examination machine, accurately and with absolute reliability. Why? Because we are going to correlate, no, the microscopic examination, the sediments that can be found in our urine. So for color, okay, color can be correlated in terms of microscopic examination with blood, no? With blood, as well as clarity. So as we discussed, the hematuria, hemoglobinuria, and myoglobinuria, we said that hematuria is the presence of RBC in the urine. And there are reasons why hematuria occur. One of the reasons of hematuria or the pathological conditions that triggers or the etiology of hematuria is because there is a probability of having a glomerular bleeding or glomerular damage. Okay? While hemoglobinuria is the breakdown of our hemoglobin due to muscles as well as myoglobinuria. Okay? But if we are going to differentiate the turbidity of or the clarity between hematuria and myoglobinuria, no? Yung pong hemoglobinuria, ang kanyang supernatant will be clear. Okay? Will be clear because our RBC settles at the bottom of the tube after centrifugation. While for hemoglobinuria and myoglobinuria are slightly turbid, okay, and the supernatant appears pinkish in color because of myoglobin and myoglobinuria. However, no, it must be confirmed or it must be further analyzed if the presence of blood in the urine is a pathologic or non-pathologic. Because as we all know, another reason rather of having a red urine or having the presence of blood in the urine is maybe due to the menstrual cycle, most especially in women. Okay, so blood positive in blood reagent strip, our confirmation will be or our correlation will be on the RBC and RBC cast. However, I want to make it clear that not all cases or not all patients with a positive reading in blood will have the presence of RBC cast. Now, RBC cast may only be seen in cases of uh, damage in the kidney. For example, post-acute, no, acute, post-acute glomerulonephritis, okay, post-streptococcal, okay, post-streptococcal acute glomerulonephritis. There will be a presence of cast, RBC cast, because of increased number of RBC, but not all cases of, or not all conditions with a positive reading for blood will have the presence of RBC cast. However, if you have a positive reading for blood in the urine reagent strip, therefore it must have the presence of RBC in the microscopic examination. Now, there are some cases naman that the blood is not present in or the blood is normal, negative in the urine reagent strip or in the chemical examination, but positive in the or there is a presence of RBC, a numerous RBC present or seen in the microscopic examination. Is it possible? Yes, it is possible if and only if no the suspension or rather the urine was not suspended, no, or hindi po siya na-mix prior to the screening or prior to the chemical examination of the urine. Next, positive in protein, so albumin, that is albumin, no? And the correlation will be cast in cells. What cells? It can be the blood or RBC, or it can be the WBC, no? For the cells. Now, for cast, why cast is the correlated or the significance no, of the protein because protein or the matrix of our cast is a protein that is Tam horsefall protein. Si Tam sumakay sa horse na fall. Okay? Si Tam sumakay sa horse na fall. That is the matrix, no, the backbone of all cast, the Tam horsefall protein, or sometimes called or formerly known as the uromodelin. Okay. Now, for nitrate, the clinical significance of nitrate is bacteria. Yes, that is correct, and WBC, of course. But there are cases like what we have discussed in chemical examination of urine that there are some cases or what we call like chorea, no, the presence of WBC in the urine that uh, non-bacterial cause, but there is a presence of WBC that is possible. No? But for nitrate, that is an indication of that there is a bacteria and increased number of WBC. Well, of course, nitrate will be possible or will have a positive reading if there is a presence of a nitrate reducing microorganisms or bacteria. But of course, if there are a numerous number or numerous number of bacteria in the urine, definitely there will be also an increased number in the WBC, which means there is an infection. Okay? So those are the correlations. No, dapat pag nag-positive ka sa nitrate, definitely it should have a positive reading for or you should detect a numerous number of bacteria and WBC. Now, is it possible that bacteria and WBC is increased but nitrate is not positive? Yes, of course. That is possible if the bacteria present in the urine are the non-nitrate reducing substances, right? So remember guys that nitrate will only be positive if there is a presence of nitrate reducing substances or nitrate reducing microorganism. It is not always positive if there is a bacteria, no? And not all bacteria is capable of reducing our nitrate. Next in line is the leukocyte esterase, though that is the WBC, no? So pag nag-positive ang ating leukocyte esterase, definitely most probably there will be a presence of WBC as well as WBC cast, no? Again, ano ba yung mga esterases natin? Sila yung Ben, no? Sila yung Ben. Ano yung Ben, sir? Basophils, eosinophils, neutrophils. Sila yung may mga esterases natin, right? Okay. However, the presence of eosinophils in the urine is an indication of allergic reaction. Thus, a, a number of eosinophils that can be seen in the urine, kapag po greater than 1% of eosinophils can be seen in the urine, that should be investigated for further analysis because again, the presence of eosinophils in the urine suggests a allergic reactions. Okay? So, yeah, WBC bacteria should be correlated with increased leukocyte esterases. And lastly, we have glucose. No, in positive glucose, no, there will be a possibility that there will be a presence of yeast. Bakit po may yeast? No, lalong-lalo na sa mga diabetic patient. Bakit po mataas yung yeast? That's why there was a study conducted by my classmates. No, I don't know why they conduct this study, but well, it's a study. Then we have to mention it since it is relatable or significant in this discussion. Their study was about the presence of candidiasis among pregnant women with type 2 or with GDM. Of course, okay, type 2 no, not type 2, GDM, gestational diabetes mellitus, no, a type of diabetes mellitus that can be seen in a pregnant woman during the pregnancy or months after giving birth. Okay, so bakit tumataas ang yeast in a diabetic patient? Yeast is seen or in urine of diabetic patient because of significant number of glucose in the urine, which serves as the source of nutrients for the yeast. Okay? Kaya kapag ikaw ay mayroong diabetic and you have UTI, no, dapat po nag-ano ka din, papatingin, no, for yeast infection kasi common po 'yan, no? Kapag may UTI at may diabetes, no, dapat tinatapos ang antibiotic. At dapat po kapag po may diabetes, regular ang pag-inom ng mga hypoglycemic agent. Okay? Hypoglycemic agents will be discussed in clinical chemistry. I will insert drugs for maintenance for diabetes, our hypoglycemic agent and hyperglycemic agent, because you don't have pharmacology subject, so I will insert those things in your clinical chemistry class. Okay, so those are the things that we have to remember in correlating the results of our microscopic examination as well as the macroscopic examination of the urine. Okay, now how are we going to prepare the specimen? Definitely, it is recommended that we should have a fresh specimen. Although, according to Strassenger, no, up to 2 hours, pwede pang gamitin ang ating mga urine sample. Or, urine samples can be refrigerated for at least 6 hours without gross, what you call this, interference, no, without gross interference in the urine structure or urine sediment. However, no, if we are going to preserve or to let our specimen stand in a room temperature, there will be a change, right? As we all know, there will be a change in the parameters that will be tested in the urine. But let's, for example, glucose. If you have the presence of glucose, or the glucose will decrease because of the utilization of the microorganisms. The odor of the urine will be affected. the pH will be affected, and so on and so forth. That's why it is recommended to test the urine immediately after the collection, or fresh urine. Now, going back what I am saying, if we let our urine stand in a room temperature, definitely there will be a change in the temperature. Oh no, there will be a change in the pH. No? Ano yung mangyayari sa pH? Tataas yan, right? Tataas ang pH. Okay? So pag tumaas ang pH, it will also affect the microscopic examination of the urine. Not only the chemical examination of the urine, but also the physical examination of urine. Okay? Now, why? Because WBC, RBC, and hyaline cast disintegrates rapidly in alkaline urine. Bakit nagiging alkaline sometimes yung urine? Yung urine sometimes nagiging alkaline because if we stand it in a room temperature for long. No? Next, a midstream clean catch urine is ideal sample because it minimizes the possibility of having external contamination of the sediments. Usually, ano ba yung mga nagiging cause ng gross contamination? No, yung po mga epithelial cells, it can be a contamination, most especially in women if women failed to wash her genitalia prior to the collection. Okay? Next is diluted urine samples or dilute random samples may cause false positive readings in the chemical examination of urine. Okay? So please take note of that. Now, how about for the specimen volume? It is recommended to centrifuge at least 10 to 15 ml of urine. 10 to 15 ml of urine to be centrifuged. Okay? And 12 ml, at least a 12 ml of urine is recommended for reagent strips, for urine reagent strip. Bakit? Because by this volume, madali po nating mai-immerse or masusok ang ating mga urine strips in the urine. Okay? And for the centrifugation, that should be centrifuged for 5 minutes at a rate of 400 RCF or rotation centrifugal force, okay, RCF. For the sediment preparation, 0.5 to 1 ml. Sir, from 15 to 0.5 to 1 ml, yes, because after 5 minutes of centrifugation, you are going to decant, which means you are going to dispose the supernatant of the urine, and you will just examine the sediment because yun naman yung kailangan mo dun eh. Because what is present in the sediment is the sediment is the one that you are going to evaluate under the microscope. The one that is present in the supernatant is the soluble substances, okay, the soluble substances that was detected already or tested already using our chemical examination of the urine. Therefore, 0.5 to 1 ml only is the recommended number or usually frequently used amount of urine for the sediment preparation. Okay? And it must be resuspended gently, gentle agitation, not excessive agitation, because excessive or vigorous agitation would destroy the WBC and RBC, or the other sediments that can be seen in the urine. Okay? So for the sediment examination, it is recommended to have a microscope. Well, of course, what the jokes are. Definitely, how you're going to do a microscopic examination without a microscope? Well, possible if you have the machine. Akala nyo ha? It is recommended if you're going to use the conventional way of microscopic examination to have a glass slide and a 22 by 22 cover slip. Okay? And then you are going to examine the slide for 10 visual fields. 10 visual fields. 10 visual fields ha. Hindi yung nakakita ka lang ng ilan sa ilang fields, you will stop and you will just uh, what you call this, estimate. No, you should examine the urine for at least 10 visual fields. And as per cast and crystals, usually they are seen at the edges of the, okay, usually they are seen at the edges of the uh, cover slip. Sir, bakit po sila nandun sa mga edges ng cover slip? So let me write. I want to write. Let me write. Bakit po nakikita sa mga edges ng cover slip ang mga cast? Because guys, remember, let's say for example, this is the broken slide. Ay, ano eh, tabing kaya broken. Okay? You have here the urine sample. No? You are going to cover it with cover slip. You're going to gently press it so that the urine rather will be dispersed, no? And then namumove niya po yung mga sediment, and usually cast will be seen on the near the edges of the slide, no? Kaya po the slide, no, side by side of the cover slip should be tested, no, to detect or to see if there is a presence of W or of cast rather. Okay? So the examination of the sediment should be done under low power field and the high power field. Remember, low power field is the what you call this? Oh my God, 10 times magnification. Okay, that is the 10 times magnification. And remember, people of the Philippines, that is used for the as initial screening of our urine sediment. Okay, as per low power field or LPO, we are going to, or LPO or LPF, you are going to observe the following: cast, epithelial cells, and the mucous threads. For high power objective or HPO or HPF, you're going to detect the presence of RBC, WBC cast bacteria. No, I'm sorry, RBC, WBC crystals, bacteria, yeast will also be seen in the high power field, as well as the presence of parasite if there is. Okay, so this is what I am telling a while ago. No, the examination of the sediment for cast, no, is usually done in near the edges of the cover slip. Okay, so bright field microscopy, it is recommended for the screening of the sediment of the urine. Sometimes sediments have the same refractive index as of the urine. That's why you have to change the light intensity, no, according to the objective, so that you will be able to detect the presence of this sediments in the urine. Okay, so the reporting manner is as follows. Okay, so for the mucous threads, again, that is for LPO. That will be 0 to 1, that is rare, 1 to 3 few, 3 to 10 moderate, greater than 10 is many. So yeah, you're going to quantify it. Let's say for example, you see a 1 to 3 per low power field of mucous threads in the urine. Instead of saying 1 to 3, we are going to report at as few. Okay, so if you see 5 to 20 crystals, that is so that masyado siyang marami, no, too numerous, no, 5 to 20 na crystals, that will be reported as moderate. Now, I will give you some no, this is not considered as a trivia, but I mean a trivia siguro. Okay, how are you going to know if the medical technologist is old enough na, matanda na siya? Matanda na ang medical technologist if they will use the word occasional. Okay, I still remember no nakwento in the video. Well, I know that you miss my stories in the face to face, but no, to give you some break, I will give a story which is related in the topic naman. I saw this Facebook post in the MedTech Launch PH, wherein there is someone who is applying for a job. No? well, definitely, if you are applying for a job, you will undergo physical and medical examination, and part of it is the urine analysis. Unfortunately, the report for urine analysis, ang nakalagay sa report was instead of saying occasional, no, the report says occupational. Ang tanda-tanda mo ng medtech, you are using the word occasional. Unfortunately, instead of saying occasional, you said occupational. Okay? You guys should be aware of what you are reporting before you release the results. Make sure that you validate the results before you affix your signature, before you write your license number. Make sure that you validate, that you review, that you uh, analyze again the results. No, nakakahiya. No, we're claiming that we are more than doctors. We are claiming that without us, the doctors are nothing. But if the medical technologist is like that, then I guess it will be better if the doctor will be the one to perform the test instead of having a report of occupational na urinalysis. Okay? So kapag po gumagamit pa ng occasional, medyo matanda na po yung references natin. No? Instead of saying occasional, then we have what we call a rare. Okay? Rare, 0 to 1 for mucus. Okay, so please have a screenshot of this slide, no? And please remember this by heart. I want you to remember this by heart. Again, please remember this by heart. All right. How about for the others? For RBC and WBC, you're going to get the average per 10 visual field or high power field, and then report it as follows. In the next slide, I'm going to show to you how are we going to report RBC, WBC, and cast. Okay, for cast, definitely the same thing, average number per high power field. For squamous epithelial cells, again, that is rare, few, moderate, many. Okay, squamous epithelial cells is the largest cells that can be seen in the urine sediment, and that is considered normal. Don't worry, guys. Having a squamous epithelial cells is normal. However, the presence of transitional epithelial cells and RTE cells or renal tubular epithelial cells are considered pathological or pathologic. No, most especially the RTE. The presence of RTE suggests tubular injury. Okay, so for that, for RTE, you're going to get the average per 10 visual fields, and that is high power field. For transitional epithelial cells, the same thing with squamous epithelial cells, rare, few, moderate, and many. Oval fat bodies, average per high power field. Bacteria, yeast, no, rare, few, moderate, many per high power field, and no, WBC should be required. Okay. The question is, I don't know if I was able to tell you this story. Well, forgive me if I am telling you a story, but the story that I am telling is relatable naman in the topic that we have. I still remember when I was working in the laboratory wherein a nurse called in the laboratory asking why the urine does not contain bacteria. Okay? Why the urine does not contain bacteria? Kasi nakalagay 0. No, the report was generated using the automated urine analyzer. So the one who answered the call was my classmate, who eventually becomes my workmate. She was too nervous in answering the question and the inquiry of the nurse because she doesn't know how she will defend the result that she released. That's why I am always emphasizing that you should be confident in what you are doing. So what happened? So I answered the call. I am the one who attended the inquiry of the nurse, and she's stating that why is it the urine doesn't have the presence of bacteria? It means that the urine is sterile. Okay, so marami siyang tinatanong about that. But I want you to note this, guys, and I want you to remember, guys, that it doesn't mean that there is no presence of bacteria. The urine is considered sterile. No, urine is never a sterile one, never a sterile. It's not a sterile fluid. As we know that is an ultrafiltrate of our plasma which contains the metabolic waste product. So why will call it sterile in the first place? I told her. And I still remember the line, I still remember that what is stipulated in the book, according to Strassenger, urine may or may not contain bacteria. Okay? Urine may or may not contain bacteria. Bacteria in the urine may be due to external contamination, or bacteria in the urine is really pathological if it originates in the lower urinary tract. Okay? So please remember, guys, that it is not necessarily that you will always report the presence of RBs or the presence of bacteria in the urine if hindi naman siya talaga nakita. Again, urine may or may not contain bacteria. Okay? So, Trichomonas, rare, few, moderate, many per high power field. Then now for spermatozoa, I am sure that I was already introduced this to you, and I was discussed it already. The presence of spermatozoa in the urine. So I will skip that. Mucus, rare, few, moderate, many, low power field. For crystals is classified as normal or abnormal. For normal crystals, HPF. For abnormal crystals, low power field. Now cast. Is cast considered normal and abnormal? No. Cast will always be considered as abnormal. Okay? So this is how are we going to quantify our cast, our RBC and WBC. Well, for RBC and WBC, that will be the same. No? 0, 0 to 2, 2 to 5, 5 to 10, 10 to 25, 25 to 50, 50 to 100, and greater than 100. We are not using anymore TNTF. No, before we are using TNTC rather. I'm sorry. TNTC, too numerous to count or too many to count. Some says too many. TMTC or TNTC. We are not using anymore too numerous or too many to count, but instead we are using the word numerous. So, ibig sabihin madami. But you still have to follow what is the procedure or the protocol of the laboratory where you are going to work. Okay, so this is how are we going to quantify our microscopic examination of urine. For cast, 10 visual fields, low powered field. So nakakita ka ng 0, 0, 0, 1, 1, 2, 2, 2, 2. The highest number is 0, the highest number is 2, and the lowest number is 0. Then your range will be 0 to 2. Well, I'm going to teach you this in our laboratory. Okay, so again, we have here the routine urinalysis correlations. So we have RBC, the physical examination, which correlated with turbidity and red urine. So chemical examination, the presence of blood and are positive in blood and protein. Okay, so exemptions, you have to count it and observe for hemolysis if there is. WBC or PAS, don't be confused if I will say PAS, if I will say WBC, because in urinalysis they are just the same. No, that will be the correlation will be turbidity. And chemical examination should be positive in protein, nitrate, and leukocyte esterases. However, However, hindi po laging positive sa nitrate, ha? Hindi laging positive. No, tandaan. Nitrate will only be positive if there is a presence of nitrate-reducing substance, nitrate-reducing bacteria. Okay? So for epithelial cells, turbidity, yes. Exemption number, cast, yeah, protein. Again, why protein? Because that is the matrix of the cast, and that is the term horseful protein or the uromodulin. Bacteria, turbidity, chemical examination, increase in pH, okay, positive in nitrate and leukocyte esterases. Okay? For crystals, turbidity, and pH. Bakit po? Because there are only crystals that can be seen in acidic pH of urine or acidic urine, and there are only crystals that can be seen in alkaline urine. Okay? So for the sediment stain, we have here the Sternheimer-Malbin. The function of this is to identify the WBC epithelial cells and cast in the urine. It will differentiate the WBC from epithelial cells from cast. Okay. Toluidine blue differentiates also the WBC as well as the renal tubular epithelial cells or the RTE. For lipid stains, we have here the stains for triglycerides and neutral fats. Okay. So remember, Sudan 3 and oil red O, no, stains for triglycerides and neutral fats. No, it identifies the free fat droplets and lipids containing cells and fats. The gram stain, definitely, it will differentiate gram-positive from gram-negative bacteria. Well, of course, I know that you are all aware of what is gram-positive and what is gram-negative bacteria. No? For Hansel stain, okay, methylene blue and eosin Y are present, no, in that stain for eosinophilic granules. Then, since that is for eosinophilic granules, then a function of Hansel stain is to identify urinary eosinophils. Again, guys, remember, if there is a presence of urinary eosinophils, no, that is an indication of what you call this allergic reactions. Okay, and Prussian blues, I'm sorry, don't laugh at me, I know you are laughing. Okay, you will fail if you laugh. Prussian blue stain, no, that stains for structures containing ions. Okay, it identifies yellow brown granules of hemosiderin in cells and cast. So those are the hematological stains and histological stains that can also be used in the urine analysis. Okay, so we have here the microscopic techniques that will be used for urine sediment analysis. So remember, guys, that bright field microscopy is the most common microscope used for routine urinalysis. Phase contrast microscopy enhances the visualization of elements. No, polarizing microscope naman aids in the identification of cholesterol in oval fat bodies, and dark field microscopy identification of Treponema pallidum. It should be italicized. I'm sorry, I was not able to review it. Fluorescence microscopy allows the visualization of naturally fluorescent microorganism, and interference contrast produces three-dimensional microscopy image and layer by layer imaging of the specimen. Again, for your information, no, of all these microscopes, bright field microscopy lang po ang ginagamit talaga sa laboratorio ng mga hospital sa Pilipinas. Okay? And you must be able to aware on how to operate the microscope kapag po magma-microscopic examination of the urine. Okay? So, I will cut the lecture in this part so that it will not be too long. And the next part of this video lecture will be all about urine sediment constituents, or the one that we are going to identify in the urine analysis. Okay, so I hope that you will still continue watching the next video, because that video lecture contains the essential part of this discussion. Okay, so thank you for listening.